COVID is something that is really affecting all of us, whether we have it or not, you know, and there are going to be a lot of people who perhaps recovered from it. And there are going to be a lot of people potentially that will get the virus in the future. And so I just wanted to offer a few ideas about how you would perhaps approach treating somebody, whether it's, you know, I don't know if you know, if we would have an opportunity necessarily to treat somebody who actively has the virus, you know, but in recovery. So if somebody is in recovery from this, or even as a preventative measure, first of all, I want us to think about it as a virus, of course, right? What we need to do is to help the immune system become stronger. One thing that we can help with is boosting the white blood cells that are being produced in the body. One of the approaches that we can use for that is treating the thymus. Okay, the thymus gland plays a big role in producing those white blood cells. The thymus point is at the level of about T4. Once you find T4, then you want to go a third of the way down the wall. When I say a third of the way down the wall, I mean a third of the way from the peak of the antihelix toward the concha, what's known as zone 3. So one thing that we spend a lot of time focusing on in terms of the map in level 1 is where are the landmarks on the ear. C0, as in the atlanto-occipital joint, along the antihelix. Where is the C7, T1, right? And then where is T12, L1, and then L5, S1. One of the things that I focus on is making sure that you know how to find those joints. And this is one of the reasons why. Because when I flip to the page 78 and I look up the thymus, and it says it's approximately at the level of T4, I want to be able to find where T4 is very quickly. The thymus point, it's a very powerful point for boosting the immune system. You can see that it's a third of the way down the wall. The other things that are going to be at zone 3, okay, along that line, a third of the way down the wall, it's basically the function of the endocrine glands. Cortisone point. Another one would be insulin. Another one would be the thyroid, for example, right? All these endocrine functions, albeit at zone 3, but they're all going to be referenced at a different spinal level. When you look up the thyroid point, for example, it's going to say it's at about the level of C7, T1. So, and then you go down a third of the way down the wall. And so if you already know in your head exactly where C7, T1 is, and then you know zone 3, okay, a third of the way down the wall, you can very quickly get to that point and be very precise. One important thing about the thymus point is it's very powerful, and it has a special effect on the treatment that no other point has, and that is that it actually cancels out all other point activity temporarily. So when you treat the thymus point, you are quieting down every other point in the whole on the whole ear for about maybe 20 minutes or so. Okay, because it has such a powerful effect. For that reason, you want to make sure if you're going to treat the thymus point, that the thymus point is the last point you do in your treatment. Okay, because if you do it first, or if you treat the thymus and then there are still other points you wanted to treat, well, now you won't be able to find them anymore. You'll have to wait till next time the person comes, or if you've got lots of time, then they can hang out for half an hour and then you can go back and try again. With the thymus point, it's really important to treat it last for that reason. so still kind of talking about the possibility of preventing COVID patients. That would be one element. Another element would be looking for points in the respiratory system. So if you look at page 60, the next couple pages, you kind of have a breakdown of the respiratory system. If the person has a predisposition predisposed weakness in the respiratory system, you will be able to find active points for that weakness. What you want to do is, of course, go around this entire area, okay? This entire area of the throat and the lungs and the bronchi and the trachea, this whole area, and look for active points. Again, you're not just going to go and just treat the lung point, right? That's not what we're doing here. We're actually asking the nervous system, is there an active point here? And if so, where exactly is it? So is it in the trachea? Is it in the bronchi? Or is it in the lung? And if they had bronchitis, chronic bronchitis as a young person or something, then chances are you'll find some old scar tissue in the lung, in the bronchi, right? For example, if they had pneumonia, you might more find stuff in the lung. But again, that's not for you to decide, right? That's for you to discover from what points are active on the ear. And in this case, remember, you want to definitely look on both sides because there are two lungs, right? And so you want to definitely look in the respiratory area on both sides. And to give you a bit of a reference, I always make sure that I know exactly where the throat point is, okay? Which is right here. The throat is right here. See? And if you know where the throat is, then you find, for the center of the lung, you find the deepest place, the deepest point in the lower concha. So if you draw a line from the throat to the deepest part of the lower concha, then you've got the line of where the bronchi would travel into the lung. Okay? So then you can kind of imagine, the picture there. And then you can find where the active point is, and then you can really determine, okay, the active point is actually in the left lung, the most active point, okay, or the bronchi. And the bronchi is midline, of course, right? It's a midline structure until it branches out. But the midline structure, then you can check both ears, the right and the left, and see where the most active point is. Okay, you don't need to, for midline structures like the trachea and the midline portion of the bronchi, you don't need to treat both ears. You just need to find which side is the most active and treat that, and that's enough. Aside from that, you are going to want to also look for points that have to do with inflammation. One really important point for inflammation is the interferon point. The interferon point increases immune defense. This is going to also be a very important point to look for. Again, if it's active, treat it. Okay, if you look for the interferon point and it's not active, then it's not going to be helpful to treat it.
I treat this point a lot. This point is very active on cancer patients. Almost 90% would have this point active.
Yeah, I bet it is. Whole system is just overreacting.
Yeah.
I'm going to give you another point. The name of the point is called beta 2 that helps with bronchospasmic conditions and the respiratory system. If somebody has pre-existing bronchial conditions, then this would be a really helpful point to look for. Again, only if it's active. It's up on the helix, but it's just underneath the helix. You see? So that's on page 213.
Dave, would you recommend, they mentioned that it corresponds to the certain body points. Would you recommend, if it's active, also treating the body point?
That's a great question. If you treat the ear point successfully, as in you actually clear the ear point and it's no longer active, then there should be no need to also then treat the body point.
But you can check it.
But you can check it. Yeah. And if you do want to treat the body point as a backup, as a you call it like a support point that you're doing for it, then you can do that. Another really nice thing about this medicine is that it does overlap a little bit with Chinese medicine. So in this book, there are a lot of references to body points. Aside from being able to treat the body point as well, it might also give you some ideas of what other meaning does this have, right? It might give you some more insight into the point itself. So those are some ideas of points to look for, symptom-wise, for COVID patients who are recovering, or for people who have predisposition, a weak immune system, weak respiratory system, that kind of thing, to strengthen their systems so that it has less of a chance of taking hold. Okay. Any questions about that?
Is there a point to increase the red blood cell count?
Probably spleen.
Yeah, right.
In acupuncture, we use the 36 stomach point to boost the immune system.
This is another reason why it's really great to have body acupuncture as well, because if you think, okay, stomach 36 is something that I would use for this purpose, then you can actually, in this book, there's a section of the meridians on the ear, okay? And so all the meridians are mapped on the ear, and a lot of these important body points have corresponding auricular points that are also very, very key. So if you think, okay, well, stomach 36 could really work in this case, then you can look it up. And in fact, stomach 36 in auricular is a point that's related to caffeine. It's a stimulating point. It's called the caffeine analog point. Okay, so now you have a location for it. And so if you go to page 323, it shows you the whole stomach meridian on the ear, okay? And it shows you right here is stomach 36, which is the caffeine point. So I would challenge you when you start thinking about solutions of different conditions in terms of body points, in terms of Chinese medicine. I would challenge you to first see if there is a match in auricular, and see, okay, does this also have a point, an auricular point that would be helpful? And then try the auricular point, and that would be a really nice way also to blend them. So instead of going to the treatment methods that body acupuncture would give you, think about, this is the point that I would look for, and then look it up in that section of the book. And first, of course, like always, see if it's active.